In April of 2009, I noticed a scab that was a little concerning and thought, I really need to get that checked out. And before I could call and get it checked out, it started draining. And so then the concern really went up. So I had a mammogram and a biopsy and a diagnosis within a week. And I was called into the office, and Dr. Tidwell met with me and my husband and said, you know, the most dreaded words anyone can ever hear, I'm sorry, it's cancer. And so it all began there. It was very hard to hear. I remember the first words I said were, I don't feel sick. And I was told, you're not sick, and this is something that we've caught really early, and this is something that we can treat. So that was really good. The scab was Paget's disease, which is quite rare with breast cancer patients. The average age is over 60 with that, and it's not something that they normally see in a 30-year-old. I was in surgery exactly 2 weeks later. I had a double mastectomy and an immediate reconstruction. And then after that, I knew that I had to get chemo. And so not ever knowing what that feels like, it's incredibly scary to know that you're going to have to go and poison your body.
First time when I discovered the lump, I was doing my monthly self-examination, and I was a little bit concerned. I wasn't too much because breast cancer doesn't run in my family. I'm still young, so it was just something there that I was kind of curious about it, so I wanted to check it out, make sure it's nothing bad. We had an ultrasound and a mammogram, which confirmed that there is a lump. But because it was kind of big, my surgeon, Dr. Weldon, decided that that's something let's just take it out. During that surgery, we discovered that it was more than just a lump, it was actually breast cancer. It was very hard to believe that this is happening with us or with me. It was just very hard. You know, I felt like, you know, we're young, we have beautiful children, the whole life is ahead of us, and we're very happy, and then there's this big news that you have breast cancer. So after the first few days of having the shocking news, we started to look forward. We knew this is something we need to beat, and we're gonna beat it. Doesn't matter what we have to do, we will get over, and it's gonna be back to normal again. After the surgery, the lumpectomy, I had to do 6 weeks of chemotherapy, which my physician, my oncologist, was Dr. Pippas, who works at the John B. Innes Cancer Center. He's extremely good. He explained to us everything we ever wanted to know about breast cancer, the treatment options, prognosis, everything. They were very helpful, setting up our appointments and make sure we're there and support us as much as they can with all the information that's available out there. One of the hardest things for me, being only 33 years old with young children, was that not having that many people, fortunately, who are breast cancer survivors. I always felt like I wanted to reach out to other people so they don't feel the way I kind of felt at the beginning before I met my friends through different support groups. And that's how I met Laura as well. And I wanted to be there for her as much as I could to show her that she's gonna, after the hard time with chemo and everything, it's gonna get better.
We connected before I started chemotherapy because I was the most afraid of the chemo because I didn't know what it was going to do to me and how I was going to feel. So I called Judith, and she so helpfully agreed to have lunch with me. We met. She talked me through what I was going to feel like. She actually even gave me a little book to help my children kind of understand what chemo would do to mommy. And so that's when we first met. So there was a lot of wisdom that came from a very brave soul. And I met Dr. Pippas, and Dr. Pippas walked me through what was going to happen, what my survival rate was, what I had to do, my drugs, what I could expect. And then when I started the chemo and started the treatment, everyone in the infusion suite was incredible. Every one of those nurses are incredible. I did my surgeries in Atlanta, but I would not have ever considered doing chemo in Atlanta if I had not had another option. Having the John B. Amos Cancer Center in town was a godsend. I was there weekly for months and months and months, and just being able to go in and get back home. It was so wonderful. This experience has changed me forever. It is something that I will always take with me. It's been a learning experience. It's been an experience that has taught me not to be afraid, to really enjoy life, to go after what you want, and to be okay with where you are. Currently, I am NED, no evidence of disease, so I'm officially in remission. I am doing wonderful. I'm feeling great. I'm getting my energy back. I'm trying to get my brain back from chemo, chemo brain. But everything else looks really, really good. My survival rate is very good, and everything looks great.
I'm a survivor. I feel very strong and happy, and I'm enjoying every minute of it. Reach out to Laura. It was so important for me because she's young like I was, and just to show her that it will get better. Her beautiful life is not over yet. It's gonna be hard, but after that, she's gonna be back, and she's gonna be much stronger than she was.
Judith and I will always have a bond of survivorship and sisterhood that nobody really ever planned on, but I'm glad that we have found each other. We still want to help young women who are going through the same thing that we went through, and that's something that we want to continue to do. Being willing to sit down and talk to somebody like Judith did and say, this is what's going to happen, and yes, it's going to be awful, but you can do it too, is something that we want to continue to do.